Hello, and once again, my name is Noel Booker with Business Credit Builder, and today we're going to be talking about, we're going to be asking you, are you overpaying for healthcare? That's the question of the day. Are you overpaying for healthcare? So today you are able to open the door to savings, and you can learn about the flat fee RX, the nation's first flat fee RX. Okay. Um, just let me give you a little quick background on myself. My name is Noel A. Booker, Senior. I'm from New York, went to Morehouse, had a couple corporate jobs, and now I started a business called MediaNet USA, where we do accounting and bookkeeping for small businesses and websites for small business. And now I talk about business credit and funding. Now, let's talk about healthcare. The healthcare industry. Um, this is known throughout the nation about the increasing cost of healthcare today. Every year, healthcare goes up. The quality of coverage decreasing, and it affects employers, individuals, and families. So I've come across something that can help a lot of people save money on their health care. Okay. Um, Let me tell you how this even came about to me, right? So first of all, my company is called Business Credit Builder, and we help companies build their business credit and access funding. David Allen Capital is my funding partner, and they also provide other business services, and now they have a healthcare division, DAC Healthcare, which, because I'm already an independent agent at David Allen Capital, I'm also an independent agent for their healthcare products. And that's what we're going to talk about today. Okay, so DAC Healthcare and DAC Flat Fee RX are the two topics that we're going to talk about today. And ladies and gentlemen, I also have Harlequin, which is a partner with me. What would your title be, Harlequin? She's like my mentor.
Yeah. Well, I'm an independent agent, just like yourself. I happen to have a large agency, and I've helped a bunch of people develop agencies as well with DAC.
Yes, indeed. And she's gonna help me describe this stuff to you today. And thank you for joining me, Harlequin.
Absolutely. Thank you for having me.
Yes. And so let me start by talking about the healthcare, right? We're gonna talk about the healthcare product. Now, with our healthcare product, one thing that's very important to know is that you have access to your own third-party benefits coordinator that conducts a thorough needs assessment of your healthcare situation. With your coordinator, you can get quotes on healthcare, and you can discover innovative products that are saving money and providing better benefits. Okay. So I want you to think of this as a third party that is going to look out for your interests. Okay. They sell the health share, but when they do an assessment of your situation, they will have access to major medicals and also the policies that are in the Affordable Care Act, right, with healthcare.gov, right? So depending on your need, they're going to give you what is best for your situation, okay? So this is a third party. They don't have their own benefit at hand. They have your benefit at heart. Okay. And I think that's an important thing because even if you have health insurance now and you're satisfied with it, it's a good idea to do this because it's free to do. Anybody has access to these third-party benefits coordinators, right? And you can find out if the policy that you're on has the needs that you are expecting and need for you and your family. Okay. That's why this is a very important piece right here, knowing that you have this third party benefits coordinator. Harlequin, can you add anything about this third party benefits coordinator and how serious it is?
Yeah, well, with the third party coordinator, they are actually licensed health insurance agents, and they will go through all of your needs. And there are times when the lowest premium, monthly premium may not be the best option for you because a low premium policy may have a higher costs associated with it. It may have a higher deductible, that type of thing. And you end up paying more in the long run. So what they do is they look at your overall usage of healthcare and determine what your average annual cost would be and figure out from there what the best options are. And so that way you know that you're getting the best option no matter what it is.
Exactly. Exactly. So let's go over what is health share. A lot of people don't know what health share is. So I just want to go over what that is. All right. Health share provides an organized structure for a community of like-minded members to contribute towards other medical costs, which makes it more effective. Right. Health shares have no set enrollment period. Members can enroll at any time in the year. Health shares are not health insurance. Health shares can help cover members' medical needs while reducing their monthly payments and out-of-pocket expenses. Um, did you want to expand on that? But was that good enough?
Yeah, well, one of the things that makes the health share plan that we market different is that instead of having a deductible where you have to pay until you get to the deductible, and then there's what they call co-insurance, with your traditional insurance plan where you have to cover they only cover a certain percentage of it. And then beyond that, they'll cover it up to a annual and a lifetime maximum. With our plan, you have what they call a max spend, which is either 1,000, 2,500, or 5,000. And beyond that, your lab work, your hospital bills, your you know, like urgent care, ambulance, all of that stuff. Once you hit that maximum out of pocket, everything is 100% covered and there is no upper limit. There was a gentleman who had COVID and was in ICU and hospitalized for several months. He had a $2 million hospital bill, and his share that he had to pay was $1,000. Everything else was covered beyond that. So that's one of the big differences with us, is that we have, it's a maximum spend, not, and everything's free beyond that.
Yes. Would you like to cover this slide?
Sure. ClearShare is the few health shares without a lifetime max limit for paying member needs, which I just mentioned. It's available in all 50 states. And I'm also going to add in there that if you happen to be out of the country, say you're on a trip and you trip and fall and break your leg, it will cover you when you are overseas. It's not set up for your regular annual physicals and things like that. But if you have any accidents or anything like that and you're overseas, you are covered on it. ClearShare has one of the shortest look back periods for pre-membership conditions, and it has the most well-defined definition of what is considered as a pre-membership condition. For example, diabetes, high blood pressure, and high cholesterol, and also COPD. As long as you haven't been hospitalized in the last year, it's not considered a pre-existing condition. Many health shares include, had symptoms or showed signs, which can be vague. We remove the vagueness and leave it simply been examined, taken medication, had a test performed or ordered, received treatment, as it would definitely show up on your medical record. So, one of the things that we recommend is to always go, and you can get just a quote from us and go ahead and sign up. We always recommend that you go ahead and speak to one of those care coordinators and go over everything in your medical history, just to make sure that you are signing up for the correct plan.
Yes, ma'am. Yes, ma'am. Okay. Best fit for ClearShare. So it's not good for everybody, right? But we can help everybody. So in regards to the ClearShare, ClearShare is an absolutely amazing product that has helped people save thousands and thousands of dollars. However, it is not for everyone. People 65 or older are not eligible to enroll. ClearShare is not a good fit for anyone who has serious chronic medical conditions. Heavy tobacco use is also not a good fit. Anyone who is younger than 65 and fairly good health will most likely be a good fit for ClearShare. I know you got something to add on to that, Harlequin.
Yeah. With this, like you said, it's mostly designed for people who are in general good health. If you're not, still go ahead and call us, and we can find, with the major medical plan that we have available, as well as the healthcare marketplace. I know right now we're still in open enrollment for that. With the healthcare marketplace, there's so many different options that our specialists can help you figure out which one is the best. But yeah, it's especially good for someone who is an independent business owner, someone who doesn't qualify for a subsidy on the healthcare marketplace. Because if you qualify for the subsidy, then that may be a better option for you. But in general, someone who's making more money with this plan, you have them saving thousands and thousands of dollars. That is true. Our CEO, he switched from a Cigna plan that had a $4,000 deductible to our ClearShare plan with a $2,500 max spend. He added all the bells and whistles that we have available, and he's still saving $600 a month on his family plan. So $7,000 a year in savings just on his monthly premiums. And we find that to happen quite a bit. Now, this is also available for companies. So if you work with a company that offers healthcare, or even if they don't currently, this is something that can be offered as well.
Yes, indeed. So here goes a quick breakdown. And I'm not going to spend that much time on this piece, but which you can find at the website. And I'm going to give you all the details. But a ClearShare membership options, we offer We offer 4 ClearShare membership types to match your healthcare needs and preferences. ClearShare only, advanced, basic, and HSA. Okay. So in the advance, you get a more comprehensive plan, sets amounts for everyday care like doctor visits, prescriptions, and diagnostics, including out of network. The basic covers set amounts for doctor visits and prescriptions in network. The HSA is health health savings account. This is when you rarely visit the doctor. Um, you pay day-to-day needs with a tax deductible HSA. For incidents, you pick your annual max, right? And this is where insurance is the most valuable right here. When you have an incident, right? And how much you pay out of pocket matters when you compare your other policies, right? So if I was you, I would go to our website and do a consultation, the assessment, so that you can figure out where you place in all these adjustables with healthcare, right? Because this is one of the adjustables. How much you pay when you have a big bill, right? So this is how much you would select one of these, which in I guess in healthcare terms you would call this the deductible, but with health share we call it your annual max. Okay, you could pick 1,000, 2,500, or 5,000. And we also offer supplemental insurance, dental, vision, accident, critical illness. Can you talk more about the importance of the annual max numbers?
Yeah, well, like I said, that if you only, say for example, you have some type of an accident, or you get an illness, you get cancer, you
Right.
want to have.
That COVID example was good in this one, right?
Yeah, absolutely. And the other thing that I will point out that is not listed in here is we have the largest PPO in the net, or in the country, that we're part of. And then we have a secondary one for areas where, more rural areas, there's another network. But what's really nice is you choose which hospital you want to be treated in. For example, if you have a rare type of cancer and the best care for that type of cancer happens to be across country, you can actually go to that hospital and it would be treated the same as it would be if it was in network. So that's a really huge difference, especially for somebody if they're from a smaller community, and the hospital near them really doesn't know how to treat that particular disease or cancer or whatever it happens to be, and you want to get the best possible care, you can go ahead and go to that particular hospital.
That's right. And that's why it's important to do our healthcare assessment so you can figure out whether or not the policy that you have now is the best for you. Okay. Okay. So all you have to do is get a quote and schedule a call. Okay. Is your healthcare insurance actually a good deal? So right now, well, you can follow the link, you do the scan, you can use the QR code, or you can follow the link and and get a quote. And that was you can get a quote right away. It takes 10 minutes to get a quote or less. And then you schedule for a call, right? And when you schedule for the call, this is the most valuable piece right here, is that you get the third party health assessment, right? And you can find out what is the best deal for you and see if you can save money. If you can't save money, well, you didn't waste, this wasn't just wasting time, because this is valuable. We're talking about your health, right? And to me, health is like one of those most important things in life. So I put God first, and then health is kind of next, because the people that are valuable to me in my life, I could not take care of if I didn't have my health, right? So you need your health, right? Okay. Now we're going to talk about flat fee RX. And the basic rundown about this is, if you're paying more than $20 per month for your prescription medications, we can save you money. Okay? That's the bottom line. Okay? It's the nation's first flat fee pharmacy program where most all prescriptions are free. Okay? Our friendly pharmacists, coaches are here to help you. If you have a question, if you need prescription transferred, sit back and relax. We do it all for you. So it's a flat fee membership, and it gets you more than 800 of the most prescribed medications for free. Okay? If the medication that you are taking, you want to find out whether or not your medication is covered, you would go to the website, right? You got the QR code, you go to the website, and there's a tab where you can search the medications. You can say something now. I know you got a whole bunch to say now. This is an exciting topic for me. I know you got something to say.
Yeah, absolutely. Well, I'm going to modify a little bit about your instructions to find the list of medications. If you go to the website, go about halfway down the page, it will say, check to see if your medication is on the list, or see the list of medications. You tap on that and it go down about a quarter of the page, and it will have two buttons. One will say you can look up your medication. The other one is to download the list of medications. I typically recommend people download the list of medications, because a lot of times people type in the name of the medication incorrectly, and so that it doesn't pull up their medication on the search thing. But we have three different areas. There's the chronic medications, where it's a medication that you're basically taking all the time. Those are shipped to you. A 3-month supply will be shipped directly to your home. With acute care medications, that's when you need an antibiotic, or you've got a short-term situation where you're only taking the medication for a short time period. Those are called acute care medications, and those you actually can go and pick up at any one of, I think it's over 64,000 pharmacies in the country, and those would also be free if they're on the list. We also have an option for some over-the-counter medications and vitamins. Those can be shipped to you for a very, very low cost. For example, ibuprofen or acetaminophen, um, I think it's $3.99 for 100. So, you can also get allergy medication and things like that are over the counter, or cough syrup. But with that program, couple of things. If your medication is not on the list, it's usually those medications that are still, they're the ones that are advertised on TV. The name brand, high-end ones, they're oftentimes insanely expensive. We can still actually get you a discount on those. We have the lowest contracted rate, and you would just go to your local pharmacy, and you may want to call and see which local pharmacy has the best rate with our card, but you can get significant discounts on those medications. The other thing is that we have a program for diabetics. Whenever you sign up with our program, if you are diabetic, they will send you test kits, test strips, things like that. The other thing is with diabetics, most of the medications, like metformin is free. But if you are on insulin, because it has to be refrigerated, you would actually go and pick that up at any Walmart pharmacy in the country. And we have the lowest price for a vial of insulin. It's only $19.88 per vial. And we also have the pens available. And I can't remember the exact price on that, and I apologize for that. But the other thing that I'm going to point out with the slide that's up, it says it's only $19.95 a month. That is for an individual. If you are a family, it would be $29.95. So you get a savings if there's 2 or more people in the household, and they consider that to be your spouse or any children living at home that are under the age of 26.
Yes,
So
yes. So, ladies and gentlemen, this is the first free pharmacy. Pay nothing for the most prescribed generic prescriptions. We have medications for immediate need, chronic need, everyday need. We have a diabetes program and a helpline, okay, where you can talk to pharmacists, okay? Make sure you act today, and see if your medications are on the list, okay? Now, before we get out of here, I just want to say one thing. If you are in a organization and you want to raise money, if you are a business and want to expand your revenue capabilities, you can become an affiliate and earn significant income by referring innovative consumer and business services. Right, Harlequin?
absolutely, most definitely.
All right,
And
so you would go to this link here, you can sign up and you can see videos on how to become an affiliate agency, how the pay plan works, and all of that stuff, right? If you're on YouTube and you're watching this, please like, subscribe, make a comment, and all that's good stuff. Any salutations or how they can contact you, Miss Harlequin?
yeah, I can be reached, well, I'll go ahead and I'll give out my phone number. Just if you call me, let me know that you heard this through Noel so that I know to give credit where credit is due. But my phone number is 404-216-9955. Again, that's 404-216-9955.
All right. Well, once again, Harlequin, I thank you for taking your time out because I know you have scheduling things going on. So I thank you for taking your time out. And we're going to get out of here on that note. We're going to come back with some more informative information about this healthcare and RX plan. So y'all stay tuned. All right. Thank y'all. Take care.
Thank you.
Yeah, let's get out of here.